So welcome everyone to the Ohio Health Modernization Movement's webinar series. This is the first of our webinar series where we are offering CLEs. So you'll notice things are a little bit different this time if you've joined us before. Folks who are getting CLEs for this need to make sure that you're engaging in the polling, that you fill out the evaluation and take the quiz, and I will post that link at the end. The Ohio Health Modernization Movement, for those of you who are new, is a coalition in Ohio dedicated to modernizing the criminal code around sharing your HIV status with an intimate partner. You can find out more about us at our website, ohiohealthmm.org, and I have placed the link in the chat to our webinar page on that web page so that you could see where our past webinars are recorded and where you would find upcoming webinars. The September webinar will be posted at sometime later this week. So welcome everybody, and I'm going to turn it over to our presenters today, who are Emily Meyer and Greg Cody, and I will let them introduce themselves. Just one housekeeping thing, please keep yourself muted during the presentation. When we get to the Q&A, you can either put the questions into the chat, or you'll be able to unmute yourself and ask the question at that time. Thanks everybody. Emily and Greg.
All right, thank you, Kim. I'm Emily, and I will be sharing my screen with our PowerPoint, so I'm going to go ahead and do that briefly. And let's see. Slideshow. Okay, y'all should be able to see that now. Let's skip right here. Greg, why don't you go ahead and introduce yourself, and then I'll introduce myself.
Hi, I'm Greg Cody. I've been living with HIV for 33 years. I have a master's in education, minor in psychology. I am an activist, advocate, and in 2014, I was top 100 long-term survivors still impacting HIV in the world.
Great. And like I said, Emily Meyer, she, her pronouns. I am the staff attorney in Equality Ohio's legal clinic in our Cincinnati office. I'm just going to give a plug for the Equality Ohio legal clinic here just briefly, because I am speaking to, I think, at least some attorneys in the crowd. We opened up our legal clinic last year. And we serve the LGBTQ community specifically in Ohio, and particularly those who are within 300% of the federal poverty line. And we practice in sort of a smattering of civil practice areas, including record sealing and expungements, to name changes, to victim advocacy, which is actually, victim advocacy is the closest we get to criminal defense work. And so I do want to caveat this. We're going to be talking about criminal laws today. And while I am an attorney, I am not a criminal defense attorney. So if some of you have questions that perhaps might be better fielded by a criminal defense attorney, we'll write down the question, and I'll ask a friend and get back to you if it's something that really a defense attorney should be answering. And so, one last plug before we get started. Our legal clinic is located, we serve folks statewide, but our offices are in the 3 Cs. I mentioned I'm in the Southwest Ohio office in Cincinnati, but we also have offices in Columbus and Cleveland. And we actually do have an opening for our Central Ohio staff attorney. My colleague Andy, who has done these CLEs in the past, unfortunately took a job with his boyfriend. They moved out to Seattle. So if anyone in the crowd knows of anybody who might be interested in the type of work that we're doing, we do still have the job posting listed, I believe, on our website, Equality Ohio's website, as well as like on Indeed.com. So just putting that out there if anybody knows of anybody who might be interested in the staff attorney position. Okay, we're going to get going. Kim explained the OHMM movement. It's a coalition of organizations and individuals who are dedicated to ending the criminalization of HIV in Ohio, and that's what we're going to be talking about today. Let's see, why isn't my slide moving? I can't seem to move my slide forward.
You go back to a screen version. Maybe that'll work.
Well, now it won't even let me escape.
Emily, how about I put up that poll while you're figuring that
Wonderful,
out?
wonderful. I will try to troubleshoot this.
Okay, so we do need you all to weigh in on the polling, especially if you're looking for CLEs on this. And by the way, our CLEs are being provided today by the ACLU, who is one of our partner organizations. So here's the poll.
Okay.
Yeah.
I got about 3 more people. I'm waiting on the polling.
Okay, I think I might just keep it in this mode.
Okay.
I don't know why I wasn't able to advance.
All right. Well, we have 2 people who haven't gone, but at this point we'll end the polling and show you that you are all amazing people. Because can you all see it? You all answered this one correctly. Yay!
Wonderful.
All right, I need to print screen. Okay, we should be good to go, Emily.
Okay.
Until
great.
your next poll, just let me know it's all set to go.
I will prompt you. Wonderful, Kim. Okay, well, we started with that poll question because we thought it sort of provided the context and the framework for what we're going to be doing today. This slide shows sort of the 4 things we're hoping to cover in today's hour of CLE credit. First, we're going to give, and Greg's going to cover this, give sort of general information on HIV, background of the virus and AIDS. Then we'll move into sort of Ohio law, how the Ohio legislature passed laws in the late 20th century to criminalize HIV status, and we'll cover the ways that happens, the various statutes that do that. And particularly, we will come to understand the legal requirements for how a person living with HIV has to disclose their status prior to any potential sexual partner prior to sexual contact, and what that kind of disclosure involves. And then lastly, 4th here on the list is learn more about OHMM's efforts at the State House, what we're doing, and our proposals for how Ohio's criminal code can be modernized in light of the fact that these laws are so stigmatizing and just have the science wrong, really. So I'm going to kick it over to Greg now. And let's.
Thank you. I'm a he, him, his. I always forget to do that. I'm sorry. I'm still from the old school. But HIV stands for the human immunodeficiency virus. Actually, I would tell you a funny story. There's a doctor here in Columbus who wrote a paper in 1979 about a gentleman with KS, which is Kaposi sarcoma. The paper was rejected. So if we're looking at HIV, it goes back further than 1982 when the papers were printed in California and in New York. But HIV is a virus. It's a lentovirus, which means it needs a host. And that happens to be the CD4 cell in the human body. What happens is it connects to the body, changes it over, makes it a factory-making machine by using the 3 enzymes, reverse transcriptase, integrase, and a protease, and those are a process. We didn't know about this till later on. That's when the medicines change, which I'll talk about later. If you have an AIDS diagnosis, it means that you have already had 2 opportunistic infections. You have a CD4 count of have less than 200. An average person has 1,000 CD4 counts in a microliter of blood. When that depletes down to a 200 level or below, there are significant changes within the body. That's why that count is relevant. you have an AIDS diagnosis. In the early days, AIDS diagnoses determined the funding for HIV in the community. So the distinguishing factors for HIV and AIDS is about the money. And about you see PLW HIV, it means a person living with HIV. We're a person first, the disease second. Always remember that. Always remember that with any disease, that you are an individual that is impacted with something, not the impactation of the disease first. Okay? Next slide then. How's that?
There we go.
If we're going to talk about the transmission, like I said, the CD4 cell in the body is the immune system. It's your fighting force. It's what your body produces, has, that protects you. The CD4 cell has two specific sites on it, the CCR4 and CCXR5. Doesn't mean anything to you? That's cool. Didn't mean anything when I taught it at the university. Okay? What matters is that these cells are around the mucous membranes of your body. The eyes, the vagina, the penis, the anal region, that's where it's transmitted to. It's also transmitted by blood products, blood to blood, okay? There's a vertical transmission of mother to child through the breast milk. The reason for that is it's the immaturity of the development of the infant, not the amount of HIV in the breast milk. If a grown individual drinks breast milk with HIV, they're not going to be infected. Your stomach enzymes, your saliva, they'll break down the HIV. It's not in fact, it's the immaturity of the development of the infant, like I said before. I hate when people repeat themselves. Okay, what happens is there are other protein fluids in the body, but HIV is going to connect to the CD4 cell, turn it over to a factory making machine, and produce more HIV. Okay? Next slide is, we want to talk about how it's transmitted. Do you want me to talk about the vaginal, which I just did?
Oh, did you want to go back? I'm sorry.
I don't know, does anybody need to know how we transmit sex? The problem with anal intercourse is not so much the fact that the discharge, it's the fissures in the body that are produced through the tearing of the tissue. Vaginal intercourse, of course, the cervix says gimme, gimme, brings it into the body. But yeah. All right, we'll go on.
Okay.
How and why laws are important for HIV. This is the big stuff. Here we go. How's my hair and makeup? Are we ready? The reason the laws are important to change for HIV, number one, is because we're changing the perspective of HIV. If we have laws that say that you're a felon by having sex, people are not going to get tested. If they don't get tested, we don't have what's called a community viral load. We don't know where the infections lie within a community. We have no opportunity to decrease that community viral load. So the virus perpetuates and grows within a community because we're not taking care of it. Because people don't want to get tested because of fear of being a felon. Take a moment right now and just think how lonely it's been the last 6 months without touch, without human contact. This is what these laws create. They create an environment of oppression, discrimination, and hate and fear. If we change these laws, we're going to change the perspective of HIV. These laws are put in place because of fear. Because we truly didn't know at that time when these laws were put into place how HIV truly was infecting other people and how the disease progressed in the body. It wasn't until late after 1995 that we broke down and found and could diagnose the replication cycle of HIV. So we move forward. We need to move forward with the laws too. In the early days of the HIV epidemic, it was very easy to tell when somebody was infected because they had the purple lesions. That was Kaposi sarcoma. With the initiation of the HIV medications, those went away. People were still infected, but you couldn't tell. Back then, you had a 2-year life expectancy. Lucky me, 33 years later. In 1995, the protease inhibitors came out. Body change. You could tell somebody was infected by the facial features that changed, the abnormal fat deposits, lipodystrophy, apodystrophy. These things became noticeable. As we progressed, new medications came out because we found out where the virus cycles were located. The reverse transcriptase inhibitors were the early ones, which caused issues. The integrase inhibitors and the protease inhibitors finally changed the face of HIV. I remember I went to my doctor and I said, you know, I'm getting fat. She said, you're not getting fat. A year later, she stood on a podium and said, we need to listen to our patients because they understand and see the body changes. She got off the podium after speaking, came back to me and said, that was for you. Okay. If we do not work together, laws, science, and physicality, we are not going to change the perspective of HIV, and we're not going to rid this disease. We need to all work together. We're down now to 1 pill a day. I will tell you, at one time in my life, I was taking 52 pills a day. I did that because I did research studies so that we can sit here right now and talk about changing the laws. Because now we are living a longer life. We're giving the expectancy of a regular life minus 10 years. And I tell you what, I don't want those last 10 years. Those are gonna be long sitting on a rocking chair. I don't need that. If we criminalize a disease based on somebody's behaviors, is that really what we should be doing? Or we need to change the policies to create an environment that's inviting and helpful. How many of you made mistakes at 24, 25, 26, and 27? Those are the mistakes that they're still making today. The fear, our biggest concern at that time was an STI. We didn't know about HIV. They do, but we're not talking about it. We're not talking about it because we don't want to deal with it. Because we realize if we get people tested, they become responsible. If you know your HIV status, you are now potentially a felon. So people don't get tested, which creates the possibility of an infection, okay? Laws are based on fear and hate, and they're criminalizing an individual on somebody else's moral compass. We don't have that right to do that to anybody. If we look at the community, if we decrease the community viral load, we decrease the impact of the communities on the healthcare system itself. By continuing testing and treatment, we also decrease the burden of the care in the community because people are going to be taking care of themselves. If we get people into care and treatment, that becomes prevention itself. The obstacle is getting them tested. The obstacle becomes realizing that if I get tested, I'm potentially a felon. We need to increase the dialogue and decrease the oppression of individuals impacted with HIV disease. To do that, we need to talk about these laws. How many of you talked about HIV in the last year? Not very many. 20 years ago, we were talking about it daily. 30 years ago, we were fearing it. We don't put it in the front page, and then it was page 8, 9, 20, 30, and now you don't see it in the newspaper at all. Why is that? Because we think we've cured it, but we haven't. It's a hidden underneath. Empowering individuals to be outspoken for their own care and treatment as well as for the community. There I am in all my glory, because it needs to be done. The more I talk about it, the more changes come about, because we then normalize it. Treatment is prevention. Right now, most of the disease individuals who are impacted with HIV that are newly diagnosed are diagnosed in the hospitals, who are really very sick, because we're not getting them into care and treatment, because they may believe that they're HIV impacted, but they're not getting tested. I did HIV testing and only 20% of the people came back for their test. That doesn't mean only 20% were infected. It just means 20% got tested. We used to be able to do it anonymously. We try not to do that. We try to get people tested in the emergency room, in the doctor's offices, because we need to find the disease so we can figure out where and how to change it and how to change the laws around it. It's nice to live in that ignorant bliss of not knowing you're HIV impacted, but that doesn't mean you're not going to be really impacted by the disease. If we get people into care and treatment early, we can keep them healthy longer. And again, that changes the healthcare system by taking the burden off them. Today, we say HIV is manageable. If we truly believe this, we must help manage all aspects of the individual's lives. This involves accepting of the disease and the person as a whole. Changing the laws help an individual see themselves as whole, not as broken. The changing the laws help individuals not live in fear of retaliation. HIV is not a weapon, and it should not be used as a weapon of control or manipulation, oppression, or discrimination. It's important that we talk about this openly. It's important that we change the laws around it. Years ago, a friend of mine was a nurse, and she went to a person's house and she put her hand on his forearm and he cried. And she said, "Why are you crying?" And he said, "I was diagnosed 9 months ago. Nobody's touched me since." We understand the disease. There's a progression of how it came about, how to control it, how to take care of it. But we're still holding on to the moral compass of HIV being a gay disease. It isn't. If we change the laws, normalize the laws, understand the laws, and create an environment that's positive, people are going to change their perspective of HIV and have those dialogues so that we decrease the viral infection in the community. Next slide. U equals U. Undetectable means untransmittable, which means that if we get the community viral load down, we also are getting the individuals to an undetectable viral load. What that means is you have a CD4 count wherever it might lie, okay? But you're also on your medications. So you become undetectable, which means it's a decrease in the viral load in your system in that microliter of blood, okay? And if the more undetectable you are, the longer you're undetectable, the less you're infective to somebody else, excuse me, okay? It punishes behavior that imposes no negligible risk of HIV transmission. So this is what we're trying to call a functional cure, which means we're not getting the virus out of your system, but functionally, you're not infecting anybody else. My virus that I have is the same virus because after I found out I haven't infected anybody. And I've been on medicine every day, that 1 pill a day now versus that 52 pills a day. So I have an undetectable viral load. And I take my medicines all the time. So I am not a risk for infecting somebody else. It's those individuals who aren't taking their medicines because they're not having a dialogue, because they're not taking care of themselves, that are creating the infection in the community. If we get people into treatment and care, we decrease their viral load, we help them become untransmittable. U equals U. All right.
Okay, thanks, Greg. Kim, I think it's time for our second poll. Please.
Oh my God.
And then while Kim is,
Here we go with, I have it ready, Emily.
oh, wonderful.
All right, here we go. Second poll.
Oh, I didn't tell you. Okay.
False. And so just thank you, Greg, for all of that background and just the lived experience and personal testimony as a person living with. That was, I think, super valuable for everyone here. And now I'm going to take it for a while. Greg was speaking. Get a sip of water, Greg. I'm going to take it from here. I will wait for the poll results. I'll wait for Kim to tell me that everyone's submitted their answer, but I'm going to take it from here for a while to talk about really getting into the actual laws and the statutes and what they mean for people living with HIV.
All right, I'm going to close the poll. Not everybody's voted, but we had that problem last time. So 92% seems to be about our max. All right, ending the poll. Here's the results. And guess what? You are all really, really good. All right.
Wonderful. And I mean, well, wonderful, everybody's 100%, but I mean, we are going to get into that harsh, very harsh penalty of if you are convicted under one of these statutes. Particularly, we have listed here are the 6 statutes in the Ohio Revised Code that criminalize HIV status, particularly the felonious assault one right here at the top. Convicted there, you can be charged and convicted as a second-degree felony, which can bring up to 8 years imprisonment per count. So that's per sexual contact, not per sexual partner. So each instance can bring an 8-year sentence, which is quite harsh. Okay, so like I said, here are the six statutes in the Ohio Revised Code: felonious assault, prostitution, solicitation, loitering to engage in solicitation. If you do so after having a positive HIV test, there can be sentence enhancements there because those behaviors are already criminalized in the code itself. But if you do so after having a positive HIV test, there's a criminal possibility of a sentence enhancement. Then we also have harassment with a bodily substance, blood, saliva, what have you. If it just gets on someone, your blood or saliva can be basically deemed under the law as a deadly weapon, and you can be charged under that provision. And then lastly, it is actually if you knowingly sell or donate blood, you can be charged with a crime in Ohio. And we are going to get into all of these in the next few slides, but first, just sort of general background. And Greg kind of did such a fabulous job on giving the background. I don't know the ages of folks here. I was a kid in the 80s, but many people, if you are older than me, remember the 80s. This was the AIDS panic, the gay panic, of course, and the Reagan administration doing nothing to alleviate it or even to address it. When we say HIV criminalization, we are talking about the concept of criminalizing, otherwise legal conduct or providing, for sentence enhancements related to the sex crimes. And these laws, Ohio is not alone in criminalizing HIV status. The very first state, gets the ignominious title of the very first state to do so was the state of Tennessee in the mid 80s, I believe 1986 was the first state to implement such a statute. By criminalizing the donation of blood and tissue by people living with HIV. Ohio then joined this, this trend of states passing such laws. There are currently, I believe, 34 states in the country that have such laws. Ohio's General Assembly passed theirs in 1999-2000. So the laws have been on the books for about 20 years now. And just briefly, again, there's 34 states, each state kind of did their own thing. But according to the CDC, HIV and AIDS laws can be broken down into 5 general categories, okay? First, there's HIV specific criminal laws that criminalize behaviors that can potentially expose another to HIV. Second, there is the laws of STD, communicable, infectious diseases, criminal laws that criminalize the behaviors that can potentially expose another to the STD or the communicable infectious disease. And this might include HIV, but not necessarily, or not specifically. The third type of law is those sentence enhancements specific to HIV. The laws, they don't criminalize the behavior, but they increase the sentence length. For instance, when a person commits the certain crimes, when the person is someone who is a person living with HIV. Then the fourth category is sentence enhancements specific to that criminalize behavior but increase the sentence length for when a person is not specifically in having an HIV status, but just generally it has an STD. So this might include HIV. And then sort of the fifth statutory regime, which is 16 states in the US that just don't criminalize HIV status. And yeah, as of 2009, 34 states in the country have such laws. So I'm going to get into detail on this on the next slide. Let's see. Okay, so we're going to focus here at the beginning on the felonious assault charge, which again can be a second-degree felony. The law specifically, this is Ohio Revised Code 2903.11. Ohio requires a person living with HIV to disclose one's HIV status prior to having sexual conduct. With another person. And so sort of, the question is, okay, what is sexual conduct? What all is included that a person living with would have to be aware of so that they can make the proper disclosures? I'm going to read the definition here. Sexual conduct means vaginal intercourse between a male and a female, anal intercourse, fellatio, and cunnilingus between persons regardless of sex, and without privilege to do so, the insertion, however slight, of any part of the body or any instrument, apparatus, or other object into the vaginal or anal opening of another. And so, penetration, however slight, is sufficient to complete the vaginal or anal intercourse. As to that, the last part of the definition where it's an object or an apparatus, that is not part of the body. It's only considered sexual conduct where the person knows that there are bodily fluids carried on the object that is inserted into the other person. So that's, especially that last part, the penetration, however slight, again, of a body part or of just an object, all of that is considered in the panoply of the definition of sexual conduct. And then what is the penalty? I sort of I already sort of talked about this when we were doing the poll, but the penalty under the felonious assault statute, which can be charged as a second-degree felony, the penalty can be up to 8 years imprisonment per charge. And not only is that, I mean, that's a lot, but say a person has 2 counts, they would be served consecutively, not concurrently. So, 2 counts, that's 16 years. 3 counts, 24, and you serve them, one after the other, not at the same time. So quite a harsh penalty there. Additionally, there's a sex offender registration requirement. If you are convicted of felonious assault under the Ohio Revised Code with a sexual motivation, the person living with is convicted or pleading guilty to the charge for failing to disclose, you must register as a sex offender. So quite harsh criminal penalties there. Additionally, under the felonious assault statute, what we've been talking about is sort of subpart B1. B2 and B3 are additional subparts to 2903.11. Ohio also prohibits a person living with HIV to engage in sexual conduct with anyone under the age of 18. And also with a person who lacks the mental capacity to appreciate an individual's HIV status. And then lastly here on the slide, there is an affirmative defense, and we're going to get into this in a second when I get into some of the case law. It's something that the prosecution has to prove. An element of the prosecutor's case in Ohio is they have to prove that the person living with did not disclose. They have to prove as an element of their case the non-disclosure of the status. Which is essentially an affirmative defense. And just Ohio's law as written right now, the only affirmative defense to prosecution or charge or conviction is actual disclosure of one's status to your potential sexual partner before engaging in any of the sexual conduct that we just defined. And so let me, so a separate slide here to be very clear. The Ohio's felonious assault statute requires neither intent to transmit nor actual transmission. Actual harm is not required. These are not necessary elements. And we were specifically noting that, again, we're talking about how harsh these criminal penalties are, and when especially it doesn't require intent and it doesn't require actual harm. And these are two aspects of the law that the Ohio Health Modernization Movement is suggesting and advocating 2 ways to change and update and amend the law, to at least require an intent element or an actual harm element. Okay, so I said I would be getting into the case law here. And if you're an attorney or a law student and you are interested in the CLE materials, I actually don't know if you've already received the materials or if they'll be sent to you afterwards. We are providing, I'll be talking about two big cases, Ohio cases, State versus Gonzalez, and then the Batista case. You will be provided with copies of both of those cases. But first, let's talk, oh, here's maybe somebody's answered this in the chat. Oh, well, I'm not gonna get into that. Anyway, let's talk about, again, that affirmative defense. It requires a person living with to disclose their status prior to any sexual conduct with a potential sexual partner. Okay, so what counts as proof of disclosure? State versus Gonzalez, this was a case out of, in my neck of the woods, in Cincinnati, the First District Court of Appeals. It was written by Judge Painter. If you know, this is when he was when he was on the court down here, a very, generally a well-regarded judge. And just noting the date here, it's 2003. So I mentioned that Ohio's criminal, this criminal regime of Ohio Revised Code provisions that criminalize HIV status were passed in like 1999, 2000. So, 3 years later, this case was probably one of the very first cases, at least an appellate case, to be analyzing these laws. And so actually, as part of the argument, the defense counsel raised constitutional questions, and I will get to those in a moment. But first, this case is a perfect example of the sort of the difficulty in proving disclosure. So what happened here, Gonzalez, he was notified that he was HIV positive, and that was, I think, established on the record. But then, and then he had sexual relations, a number of times with his girlfriend, and then, they broke up, and I don't know how, she learned about this law, or she learned about his positive status, and decided to, press charges, and he was charged. And so, again, there were constitutional questions, constitutional challenges to the statutes, but additionally in the case, there was a dispute as to whether Gonzalez made an adequate disclosure or not. His girlfriend argued absolutely not. She never knew. She learned from a third party after they had already broken up. But Gonzalez, as the defendant, trying to prove that he did properly disclose, he brought in, I think, 4 different defense witnesses to try to establish that he did disclose. One was his sister. One was an ex-girlfriend, both of them sort of attesting to the fact that, oh yeah, he definitely knew he was positive, and he generally, he is one to just talk about it. The other ex-girlfriend, this other girlfriend, talking about, oh yeah, he mentioned it to me. I knew, prior to any sexual relations, I certainly knew. So it's very likely that he told, the victim. Alvarado is her name. And another defense witness that Gonzalez brought in was his case manager at, I think, the AIDS Volunteer Network of Cincinnati. I don't have that exactly correct, but brought in his case manager to again testify to, yes, Gonzalez, he knew that he was positive, and he generally talks about this. All of that was held not persuasive to the jury. This is all to say it basically came down to a he said, she said situation, right? And then they're bringing in witnesses to kind of bring credibility to each other's statements. And again, ultimately the court rejected, or the jury rejected and sided with the victim in the case, Ms. Alvarado, in finding that Gonzalez did not adequately disclose. In the next slide, we're going to talk about our recommendations for how to adequately disclose. But because I have lawyers in the crowd, I do want to touch on those constitutional challenges, just in case folks are interested. Gonzalez, or his attorney, brought several challenges, which again, the Ohio laws had only been on the books now for like 3 years. First, they tried to make a void for vagueness argument, arguing that they didn't quite know what disclose meant. Also, wondering, does disclose, does it mandate like a signed and notarized, statement by a person living with? Judge Painter, like I said, Judge Painter wrote the decision. He kind of quickly refuted those arguments. He said, a person of common intelligence that's quoted from the case. Everybody knows what disclose means, and of course, verbal disclosure is adequate. Again, the case, though, highlighting the difficulty of proving verbal disclosure, which is another thing. Another constitutional challenge was Eighth Amendment, that it was cruel and unusual, the statutory regime, arguing that it's mandating punishment without intent or knowledge, and the court quickly refutes that one as well, stating that it does require knowledge. A person living with knowingly having sexual conduct with someone without disclosing. And then there was also a due process challenge, arguing that there was no affirmative defense offered by the statute. Like I said, there is an affirmative defense in that if a person can prove that they adequately disclosed. In Ohio, as compared to some other states, it's more of a failure of proof defense where it's the prosecutor has to show as an element of their case non-disclosure. And so in that way, the court said, no, there's no due process, or there's not a lack of due process in the statute. And so, again, this is probably one of the first times, at least an appellate court in Ohio could review the statute on a constitutional basis, and it upheld the statute. Okay, next slide here. We're going to briefly talk about, okay, so, the he said, she said, or she said, she said, he said, whatever your pronouns are, that can be tricky. If you are a person living with, to sort of put all your eggs in your basket and to worry about, oh gosh, is it going to come down to that, where it's just, putting witnesses up and trying to prove that you said the thing. Here are ways listed on this slide a person living with can demonstrate disclosure and maybe have a little bit more comfort in, should they ever be challenged on their disclosure. Recording the verbal disclosure to their partner on video. We're 20 years since the laws have been passed. Everybody now, cell phones with cameras are ubiquitous. Ohio is a one-party state as far as submitting recordings, so long as one party agrees to the recording. So, recording it using your phone or other means. Requesting a partner to sign a statement acknowledging that you disclosed, and then keeping that signed statement. This is actually with my clients, at least in other fields, this third recommendation, saving the screenshots. If you communicate via text, or especially on apps, social media apps, dating apps, Tinder, Grindr, whatever, screenshotting those, making sure that there are date stamps and like who was involved in the conversation or the text exchange. That could be a good way to record the disclosure. And then, here's the fourth suggestion here is, getting a third party involved. Requesting the partner accompany you to, or the person living with, to a doctor or to the caseworker's appointment. And then the caseworker or the physician, puts it in the file that, hey, the person's partner was with them. We all talked about the, positive status and what that means. And then, then it's in the client file. Should you ever have to produce it as evidence in a prosecution. Okay, and then I mentioned there were two kind of big cases that I'm going to cover today. This is the second one, State versus Batista. This is the Ohio Supreme Court weighed in on this just a few years ago in 2017. Sort of similar fact pattern to the Gonzalez case in terms of Batista, in the record it's shown, or it's established that he knows that he's HIV positive, but then has sexual relations with a girlfriend. And then, they break up and the girlfriend finds out about his status. And he was charged. Now this case was decided in 2017. So it's been 14 years since the Gonzalez case. And so Batista and his counsel brought constitutional challenges again. Here, the challenges were based on First Amendment free speech challenge, and then also an equal protection challenge. Similar to Gonzalez, the Ohio Supreme Court, it made it all the way up to the Supreme Court, and the Supreme Court upheld the validity and the constitutionality of the statute. It said that, so Batista's challenge there was that requiring a disclosure, disclosure of status is compelled speech under the First Amendment. And the majority of the Supreme Court said, Yeah, no, it's not compelled speech. It's where the statute is, it's more regulating conduct. Any regulation of speech is incidental. And because we're regulating conduct, not really speech, they only had to use a rational basis review as far as, you know, a constitutional review of the statute. And it found, you know, it found that it met the rational basis review. I will note that there was a judge, Pat DeWine, our Governor Mike DeWine's son is a Supreme Court justice. Pat DeWine concurred in the decision. He actually found that the statute does directly regulate speech. And so he would apply strict scrutiny, a strict scrutiny analysis to the constitutionality of the statute. But again, he's concurring in the judgment because he finds that the statute does meet that high burden of strict scrutiny. So interesting. And then the equal protection challenge was also knocked down by the court, noting that there is no suspect class involved. And Batista, they tried to argue that, well, why is the state, why are these laws criminalizing HIV status? Why don't, you know, we are being discriminated against in the sense of why aren't they criminalizing, let's say, hepatitis C status? And the court said, again, that isn't a suspect class. And, you know, that type of argument is really one that you take it up with the state assembly, basically take it up with the General Assembly. That's an argument to be made to the legislators, not to the court. So that's where we are there. I'm just noting the time here. Kim, why don't we do the third poll question, please?
There's the third poll, if you would all take a look.
Wonderful, another true false here. Yeah, and that question is really recalling back what we kind of covering what we covered a couple slides ago, just seeing if you remember. While we're waiting on the results here, I'm just going to briefly on this slide, again, you know, we've been talking mostly in the case law so far, you know, in the 20 years that there have been charges and prosecutions under the laws, at least the ones that, you know, become published as appellate decisions have been under the felonious assault statutes. But again, recalling my early slide with the 6 different statutes, just a reminder that, you know, Ohio's law does currently criminalize HIV status for other things in addition to felonious assault, criminalizing, you know, prostitution, solicitation, loitering whilst engaging in solicitation. There are sentence enhancements if a person does any of those, you know, already criminal behaviors with knowingly with having a positive HIV status.
Emily, I think it's been a while since anybody's posted. I'd like to put up the results. I think you need to review this question.
Oh, okay. Okay. So again, true, false, and maybe this is just how it's worded. The question was, it is an affirmative defense to a charge of felonious assault that the defendant had no intent to cause harm. And so again, that's false. Intent is not currently an element of the crime. Intent is not required. The prosecutor does not have to prove that a person living with had the intent to transmit the virus. And so it's that's what we were getting at in that question, the intent element. And that's, again, one of the things that OHMM is advocating to at least add an intent element to the crime. You know, if we're going to continue to criminalize this type of behavior, let's at least require a charge, the behavior to be intentional. So that's what we were getting at there. Okay, so, you know, again, just touching on, you know, that sex work, the sentence enhancements there. There's also, I mentioned, it's ORC 2921.38 is, what do they call it? Harassment by bodily substance, I believe it's what it's called. And this is, like imagine the scenario, I don't know, a person living with is upset, acting out, police, the police are called, and for whatever reason, the person spits on or somehow, vapor from your mouth, which we all know now that we wear masks all the time, how a person, even if you're just speaking loudly, the water vapor from your mouth. But if spit or bodily fluid gets on an officer, on a law enforcement officer, again, your spit or saliva can be deemed under the Ohio Revised Code as a deadly weapon if you are a person who did so, knowingly with a positive HIV status. So just another, method that the state is trying to criminalize behavior, and behavior that has a very, very low risk of transmission of the virus, right? And then lastly, I touched on this earlier, if you donate or sell blood knowingly while HIV positive, you can be charged with a crime. Not to mention that donating blood, the American Red Cross or wherever you're donating blood, they test for all that anyway, right? They test for any viruses, diseases, but if you have a positive HIV status, you can be charged with a crime under Ohio's law. Moving forward. Okay, this is maybe information for when I'm not talking with a legal crowd, but what to do if you are a person living with, what should you do if you are arrested, risk for arrest. This is sort of just good advice generally, but ask for an attorney as soon as you can. Again, I'm not a criminal defense attorney, but from what I've been told, the best advice is, hey, tell law enforcement I'm going to stay silent until I speak with an attorney, and leave it at that. And do comply with law enforcement. You certainly don't want to be charged with spitting on an officer, even if it was unintentional, right? And so again, the advice on this slide is pretty, for I think if you're ever have an interaction with law enforcement, but don't disclose your status to law enforcement officers. Don't talk about anything if you haven't talked to your attorney first. Don't sign anything without an attorney. This is just all, good advice here. Briefly, we've been talking about crimes and criminal convictions and charges. You may know that depending on the charge, depending on a person's record, you can get some things, sealed or expunged. Those are technically two different things, although people use them synonymously, off your record. Here's just a slide that generally these 6 crimes that we've been talking about, or the 6 statutes, generally a person can't get them sealed. The first 4, generally you can't unless you can you can swing it under the special expungement rules for if you are a victim of human trafficking. But so generally no. If you do have any questions on that, that's sort of a whole other presentation. I could give a whole presentation on record sealing and expungement. So we'll leave that there. Okay, and then I think we're gonna kick it back over to Greg briefly, but Kim, let's do our fourth poll, please. And just while everybody's voting here, just the remainder here, and we're going to go a little bit over, but we'd rather go over than be too short, because OSBA requires a strict hour at least. But the remainder of our discussion here today is going to be about OHMM, and particularly our efforts to modernize Ohio law. And so, Greg, why don't you get us started with why we should do so?
Might help if I take my mute off, huh?
I just did it for you, Greg.
Thanks, love. Okay, the leading public health and legal experts believe the laws need to change. Why? Because the science is prevailing and the laws need to catch up to the science of the disease. Ohio laws, criminalized laws opposed by the ACLU of Ohio, the National Alliance of State and Territorial AIDS Directive, NASDAQ, and the National Association of Criminal and Defense Lawyers. That's you guys, okay? The laws are unfair and stigmatizing. The laws are costly. You spend more money in court than is worth it. Let's be real. Why are we penalizing people that don't need to be penalized? The intent and purpose matter. Okay. Most people don't intend to infect anybody. Most of the ones that are infected by people that don't know they're actually infected themselves. Okay, well now we have another poll. How's that? Oh,
And yeah, it looks like everybody 100% there.
yay, you guys are awesome. The laws, again, were based on fear, and they were a political move in the 80s when these happened. So let's change the perspective. Let's change the platform. Let's change the world one piece at a time. And this changes it. This creates a even playing field for all people. One mistake does not mean that they should be paying for the rest of their lives. Okay? How's that? We okay? Yep. Okay. These are the proposed changes to the Ohio laws. Prove it. You need to prove that you intentionally tried to infect somebody. We need to consider the risk that were involved. Oral sex is a theoretical risk of HIV transmission. Your saliva has proteins and enzymes that will kill HIV versus anal intercourse without a condom. There is a big difference in those. Remove HIV-specific felonies, and we require proof of transmission. You know, you can't say, "Oh, this person infected me." If we look at HIV, there's lines that are broken down, and you can figure out who and how you were infected. Mine is a linear line because I only had one from the beginning, but somebody else's, there's different variables based on the drugs that they're on and who infected them, and the geno and phenotypes. Okay. Remove specific penalties for enhancements of sex workers. We create that environment. Why are we penalizing people for having to go to that route? We need to take into consideration and remove penalties for other health conditions. Remove the requirement to register as a sex offender. It doesn't make you a sex offender because you engage in sexual activities because you're HIV positive. And just because you want to donate blood does not mean you should be penalized. It means you should be smacked, but that's just my perspective, sorry. Okay. It's a body of evidence to date has established that there is effectively no risk of sexual transmission of HIV when a partner is living with HIV. We already talked about that. Dr. Anthony Fauci, 2018, which means he took a conservative perspective for 5 years with the National Institute of Allergy and Infectious Disease before he put that statement out. And in 1995, we were talking about undetectable means untransmittable. I'm sorry, in 2005, we were talking about undetectable means untransmittable. Okay? If you'd like to find more information, you have the Ohio Health Modernization Movement, the Center for Law and HIV Policy, and of course, the amazing Serial Project. If you guys have not had an opportunity to look at the Serial Project, I strongly suggest you look into them. They're an amazing organization. Others, the National AIDS and Defensive Association, the Center for HIV Law and Policy, and of course, the ACLU AIDS Project. Or you can talk to someone who's HIV positive. Well, some of us aren't afraid to talk, obviously, but We're here for you. Oh, I'm going to tell you a funny story before quickly. I got pulled over for drunk driving. I was sober. So after they took me in, did a breathalyzer, took my blood, taking me back to my car, I told them I was HIV positive. This stuff wasn't out there. We spent 20 minutes talking about HIV. Not all people are bad. Not all people are good either. But if we create this environment of conversation, which is why we're going to ask you questions now. Anybody else have any questions?
And I will just note that that chart that Greg went through, that is the third item in everyone's CLE materials in addition to those two cases. So you will have access to the OHMM chart and how we are advocating to modernize Ohio's criminal code. Any questions? Kim, I haven't been monitoring the chat. Have there been questions in the chat? Oh, you're muted, Kim.
Sorry. The question that was asked in the chat was if the dating apps allow you to note your HIV status, and would that count as disclosure? And both Greg and I kind of responded to that it's difficult to prove the person saw it. So it's not a recommended way to avoid getting caught up under these laws.
Yep.
For those who are not doing this webinar for CLEs, will these slides be sent out to everyone?
Yes, I will be sending to everyone who registered. There's always a follow-up email the next day, and we will include the slides for everyone. The CLEs are only being offered to those who are present today, however, just because of the greater difficulty around offering CLEs than CEUs.
All right. Well, I would say if there's no other questions, Kim, did you want to give it? How are we doing the quiz at the end? Everybody will be sent that, correct?
Well, it's also in the chat right now. I put it up right at 1 o'clock. I put it up in case somebody had to go. And it will also be in that email tomorrow, but it's right there in the chat. What I will do is I'm going to, if we're done, Emily, I'm going to turn the recording off, but I will remain a little bit longer so that people can access that link as they exit. Somebody's saying that the link doesn't work. Oh, hold on. All right. We'll go with the longer version of the link. Hopefully this works. Oops. Let's see. Jill is asking, what is the status of the legislation? Is there a pending bill currently or a potential sponsor? We're working on potential sponsors. The bill is being written up by LSC. It's in its second round. Somebody else, the link opened, but hitting next doesn't work. So let's try this longer link that I just put in. And Olga says, awesome job. All right, I'm going to turn the recording off, and I'll stay on for a while in case people need to access the link. Thank you, everyone.
All right, yeah, I just want to say thank you, everyone, for joining us today.